HealthWorks, providing trusted, culturally appropriate information and resources. We aim to strengthen vaccine confidence and prevent outbreaks of vaccine-preventable diseases where we live, worship, work, and play. Increasing access to vaccine and booster shots for diverse, medically underserved populations. Engaging communities, families, and businesses in the fight against COVID-19.
Welcome to HealthWorks, a podcast series that highlights the multi-state COVID-19 consortium in Georgia and Tennessee. This consortium is led by Morehouse School of Medicine, Meharry Medical College, and ASHLIN Management Group in partnership with One Joshua Group, Black Girl Health Foundation, and Mojo Marketing. This podcast series will discuss the efforts of the consortium to reduce COVID-19 health disparities and advance health equity by strengthening vaccine confidence. Thank you for joining us. Hello, I'm Kermit Payne, president of One Joshua Group and host for this series. And HealthWork aims to reach individuals in the most vulnerable and medically underserved communities where there are often high levels of COVID-19 infection and often lower than average vaccination rates. This consortium's aim is to engage community health outreach workers, including businesses, to conduct education and training, COVID-19 testing, vaccination events, and other outreach efforts. Today's program is going to focus on establishing and training a statewide workforce that'll include HealthWorks outreach workers in Georgia and Tennessee, and also look at some ways that we can engage businesses in this training to increase vaccination rates, again, in Georgia and in Tennessee. Our guests are representatives from Morehouse School of Medicine, Meharry Medical College, and ASHLIN Management Group. And to start our discussion today, we're going to speak with the Morehouse School of Medicine representatives, which is the lead organization of the consortium, Gail McCray and Patricia Parsons. Hello, Gail and Patricia.
Hi there.
Hello.
Good. Welcome, and thank you for joining us. We'd like you to share with us some information about the responsibilities of HealthWorks, particularly with Morehouse School of Medicine as a lead on this initiative, and what is that relationship to training a vaccination workforce, increasing access to vaccines, learning more about the importance of the COVID-19 consortium efforts. Gail, tell us about the issues around the training for the vaccination workforce.
So we have planned a workforce in the community of about 100 what we're calling health outreach workers. And that's to be distinguished from some know community health workers. Health outreach workers are it's a different workforce. They'll be trained differently because this program is it's a very intense, short-paced program, or very strongly paced program. We are hiring temporary part-time workers at competitive wages. We will train them in all areas that they need to know about the vaccine, about why people hesitate to get vaccines. We need to get them to let the community know, and they will be hired primarily from their own communities, but to help them to be able to address the concerns of folks about any issues they might have with getting a vaccination, with any questions they might have about who's eligible, where they might be able to get vaccines. We're 2.5 years into the pandemic. And so, many of the easy people to get vaccinated already have done it. Those people with remaining questions, who may have gotten misinformation, who are looking maybe hopefully to change their minds if they've not had any of their vaccinations. We're going for that group of folks at this point. And so they will be trained online in areas of facts and myths about the vaccine. how to identify resources for testing, for getting vaccinations. This is a medical condition, so we want people to respect respect HIPAA laws, and
Mhm.
so to observe privacy and confidentiality. Just areas of community engagement, how to develop partnerships to get this work done.
Mhm.
So
So, Gail,
that's part of the training.
I believe that the lessons learned here, and part of what this particular consortium is going to be most effective, is having understood that the implications of culture. So we training, as I understand, that these are it's going to take place in communities where people live, work, play, age, and worship. The workforce is going to be comprised of those individuals who live in those communities,
Yes.
and it does something to increase the workforce, to make available through trained individuals to give information not just about COVID-19, but about broader way of accessing services. Now, one of the parts about this, um, Pat, I think, as I understand and read this, there will be events, activities, sessions that follow the training. What kind of activities will Morehouse School of Medicine be developing so that these people, once they get trained, give individuals an opportunity to get vaccinations, boosters, to get more information about improvement from COVID 19?
Yes, they will. That for the HealthWorks grant, this specific grant, we have to have 10 events, vaccination events in communities in the state of Georgia. I am presently working with Dr. Christopher Irving, who is our director of our Georgia HEAL Clinic, Health Equity for All, to ensure that we meet those goals of having those 10 events for this period. For example, this Saturday, we was in Washington Park, June the 4th, and we had our first event, PAs in the park. And basically, it was a great event in terms of the number of people who attended. There was a softball game going on. There was a DJ. There was a person doing chiropractic work from the physical therapy from Georgia State. So there was a lot of people at the event, and then we were there to provide health screenings along with
Hmm.
vaccinations. So
Hmm.
we was able to provide 6 booster shots this past Saturday, and then we signed up individuals for our focus groups, which we're going to have
Hmm.
virtually later on.
Now, Gail, you mentioned something. Pat talked about that. We talked about events. We talked about the training. Is there any cost for this training to the people who want to be trained?
The training is absolutely free, and it's a part of what needs to be done. The more people we have out there who know how to follow the science
Mhm.
and how to communicate that to other folks, the better off we will all be as a state. And I did want to mention one additional thing, and I thought you were going to mention it just now. But in addition to COVID-19, these folks will be trained in emergency preparedness, because COVID is just one of the crises that we are
Exactly.
under at this point.
Mhm. Yeah. So there's other question that people ask, and I'll get back to you, Pat, on this. So, is there any cost to get the vaccinations?
No, there's no cost. These are free vaccinations, and we are giving the first and second shots as well as the booster shots.
So, are all of the different types of vaccinations available at the events?
Yes, Pfizer and Moderna.
Great. It's good to know that. Thank you so very much for that. We've talked about outreach workers, we've talked about events, and these are essentially for those that are consumers. And there's another element of the HealthWorks Consortium, and those are how we are attracting and engaging businesses. Mr. Rami Chami, who is with the ASHLIN Management Group, addresses those components that specifically focus for businesses. Rami, can you tell us something about the ASHLIN Management Group and how you are directing these activities, both in training and events for the business community?
Sure. Ashlyn was brought into this project because of our prior experience of bringing businesses into health related projects for the Department of Health and Human Services. So this is a continuation for us of work that we have done in the past. For this project specifically, we are recruiting businesses in Tennessee and Georgia, which are the target states we are looking at. Our aim is to bring in minority business enterprises that can help educate their workforce about the importance of COVID-19 vaccination, but also create opportunities for those workers to get vaccinated, the family members of the coworkers, as well as the larger community around the business. And so we train someone who the business designates as their small business health ambassador to go through a short training on COVID-19 best practice in the workplace and how to schedule vaccination events, which they will do in due time as the health outreach workers and the community health workers in either Georgia or Tennessee come online, and we can make those pairings so those vaccinations can get coordinated between the business and the surrounding medical facilities around them, whether it's a pharmacy, medical center, or otherwise.
So I would imagine that as an individual, it just makes sense that I get a vaccination. So, Rami, why is it important? Why is it necessary that we create a focus specifically for engaging businesses in in looking at the issues around vaccination uptake? Is there any difference in the training for the businesses than what Gail talked about or what Pat talked about earlier?
So there's a lot of similarity. The idea is that someone from the business is elected to learn about COVID-19 safety and best practice as it applies to a work environment where you're often spending a lot of time with people in a confined space. And so practices such as better ventilation, social distancing, and very importantly, just how do you convince coworkers that might have questions or
Mhm.
uncertainties about the vaccine, about the benefits of getting the vaccine, and just the tremendous amount of evidence that is effective and at minimal risk to people.
So, and when we talk about these, we spoke earlier about the issues related to culture. So, what also happens here is that these businesses exist in these very same communities. So, the business owners in these communities, just as the community outreach workers, will uh, exist in places where people live, work, play, worship, age. So, it's not that we're bringing people outside of these communities to be able to provide this information. So, ASHLIN Management Company for Morehouse School of Medicine and for Meharry Medical College, it is absolutely for us to commend the work that the consortium has undertaken and the benefits that we do. Now, Rami, you mentioned Gail mentioned Georgia and Tennessee. Gail, you and Pat talked about some of the work in Georgia. Dr. Chandra Wade is actually with Meharry Medical College in Tennessee. Dr. Wade, can you give us some information about the training and the outreach and the events that take place in Tennessee?
Yes, we are recruiting 100 community health workers here in Memphis. They will start the training on June the 15th with UT Medical Health Science School. We are also recruiting for barbers here in Memphis. We have over 20 events scheduled from here until Juneteenth. We have partnered with local churches, businesses, small businesses, and other organizations with our events.
So we appreciate that. So now we know that in Georgia, we have outreach training. In the state of Tennessee, we have outreach training. We have events around vaccination, the access to services, not just about COVID 19, for both general users and, as Rami mentioned, those activities that focus specifically on business. Now, we have something that's a little different, and this is a comprehensive activity. Ms. Patrice Guzman, who is with Black Girls Health Foundation, can you tell us about the foundation, Patrice, and also tell us the kind of activities that BGHF undertakes?
Absolutely. Um, well, with Black Girl, so our college ambassador program is what's really going to be focused within this particular project. And our program engages underserved, low income African American women. We recruit college students to become health ambassadors in their community. And it's the goal for these ambassadors to help educate, um, localized social media health campaigns to engage Black women in urban and underserved communities. So we really empower underserved Black women to stay on track and improve their health by providing individualized care through frequent access to health professionals, health information, activity, and resources. Um, so our so as part of our engagement strategy, it's really more focused in a more digital capacity. Um, so it will utilize social media platforms as well as digital newsletter platforms and
Okay,
promotion.
great. So from what I'm hearing, is this is really a comprehensive program. In the state of Georgia and in the state of Tennessee, we have training for outreach workers, for patients, consumers. We have programs that engage businesses. And we looked inside of that, as Patrice said, and we've gone to a population of younger people, college age. Patrice mentioned the word ambassadors. Rami mentioned the word ambassadors. And Gail, in her wealth of knowledge, will tell us that this kind of training and this kind of learning takes place from the bottom up, not from the top down. We look at Patrice's audience and the number of young people who are in the homes to encourage those people who may be reluctant to get vaccination, to use those as a matter of encouragement. And I want to go back to Gail for a moment. We know about the need for accurate and reliable information to increase the vaccination workforce, then that increases outcomes. Who is eligible to be trained for these community health outreach workers? And I'm going to come to Rami with the same question. And how are they selected?
So we put out announcements all over the state in all the health districts. Some counties, some health districts are have a um, um, higher positivity rate in terms of their COVID tests than others, and so we'll emphasize those areas more than the ones that have higher control rates. We're looking at prevention and control. And so, whether it's an urban or rural area, medically underserved areas, we're looking at all of those different areas, and hopefully, we can recruit from the areas where we're needed most, where the information is needed most, where the services are needed most. We are looking for people who are able to work part time for about 4 months. It's not a permanent job. This is a temporary part time job. And so everyone's not interested in that kind of work. And so, we're hoping that there'll be public health students, there'll be former community health workers who may not be working at this point, people who really have a passion for their communities, who may have done similar work before, but people who know their communities very well and have a passion for developing partnerships and collaborations so that we can reach people who have not yet been reached.
So,
So
Gail, I'm sorry, you mentioned that. And so, to get to you, Rami, how do you identify businesses who would have an interest in becoming a business health ambassador and the training? And how, I mean, how do you determine who's available to do that? And what is the duration? Gail mentioned that the engagement there is around 4 months. What is the duration for those people who are business health ambassadors?
The duration is similar. It's how quickly they can go through the training process and then get the vaccination campaigns that they want to get done. So they may be done well before 4 months. They may be done within a month or so, depending on how robust the program that they develop is. The way we bring in and identify the businesses is through a number of channels. One is we have developed or procured multiple minority business enterprise lists in Georgia and Tennessee. And we have internal teams that go through those lists and reach out to the businesses via email and phone outreach. And we have a decent amount of luck bringing in folks that way. We also work through what we call gateway organizations. These are chambers of commerce, business associations, and we reach out to them and say, we're looking for members of your organization or network that might be interested in this program. And we've had several come in through that channel. We also, through our website, have a way for folks to register to the program directly. They may hear about the program, be interested, and they can go to the ashlininc.com/HealthWorks website and register. Well, they registered to express interest in the program, and that will trigger the registration process. So there's a number of ways to do it. Also, even if you are not yourself interested, say you're a business and you're not interested, you can refer another business, or if you know of a business that you think might be great for this, you can go to the website and refer that business. We'll reach out to them and see if they're interested in joining.
Well, it appears the opportunities are there. And Patrice, I want to go with you because how do you, for your college ambassadors, how do they find out about you, and how do you find out about them? And then how do you link up once you know you've that either they've identified interest or you've identified interest? How can they find you?
One is reaching out to historically Black colleges and their professional offices and just letting them know that this opportunity is available. We've also utilized a platform called Handshake where we can kind of narrow down the types of students. So we focused a lot with trying to attract those students who do have an interest in public health. And that's where we found a lot of our success with our recruitment strategy. And then we've also utilized just some of the normal job sites that are available, such as Indeed and LinkedIn, to do some of our recruitment. Again, really targeting those who have that interest in public health. And we found a lot of success during our recruitment.
So I want to go back to Dr. Wade for a moment, the Meharry Medical College representative. So Gail mentioned the outreach training. Pat talked about activities, events recently, one that they held. Rami has share with us ways that people can be engaged, as has Patrice. Tell us some of the activities that have been taking place at Meharry Medical College and some of those upcoming events. And what does that look like? How do people find out about those events?
With our events, it's usually word of mouth. We're using the radio stations. We use all social media platforms, Facebook, Instagram, and LinkedIn. One of the events that's happening in Nashville is the Juneteenth event. That was supposed to bring over at least maybe 2,000 people at that event. And the one in Memphis, we usually have between 1,000 and 2,000 folks, people at our events.
Well, that's exciting. This is the month of June, and having these kind of activities around Juneteenth is critical. It seems that there are masses already accumulating in these opportunities. Pat mentioned something that Morehouse School of Medicine, I think it was PAs in the park. So it appears that the consortium is going to where people are. That is a part of the cultural relevancy to make the consortium important. I want to ask you again to go back to you, Pat. Why is it important, and why was it important for Morehouse School of Medicine to create this kind of consortium and take the lead on developing and increasing a workforce to address the issues of vaccine uptake and new services access as well? Gail reminded us that it's not just about COVID-19, that these events provide other kind of services. Why was it important for Morehouse School of Medicine to take the lead on this?
Have we are represented in the communities that we help in terms of underserved and the poor populations, but we wanted to make sure that we partner with other institutions that could also help. For example, Meharry in Tennessee and ASHLIN here in Georgia, but they also working in Tennessee, and Black Girls Health Foundation, to actually work with people in our consortium to make a difference in their communities as well. Communities that are that they have underserved individuals living in, that we could make a difference in terms of decreasing vaccine hesitancy in both states, Georgia and Tennessee.
Well, this has been an enlightening conversation, and I think that Morehouse School of Medicine, Meharry Medical College, ASHLIN Medical Group, the Black Girl Health Foundation should all be commended. First of all, because this gives us an opportunity to address a very relevant issue, and that is around hope. And also to look at some of those things that make it human. This in our communities, people who are doing this work, who live in these communities or part of these communities. Dr. Wade mentioned that we're even engaging some of the barbershops, very specific kind of civic and social engagement. So what I'd like to do is I will start in alphabetical order. We'll let you guys figure that out. We'd like to give you 15 seconds, if you would, to introduce yourselves, tell us what you do, and also introduce your organization. We will start with Rami Chami.
Sure. I'm Rami Chami. I'm the project manager on the ASHLIN Management team's side. And we are working with businesses in Georgia and Tennessee to bring in these minority-owned businesses to implement programs that encourage vaccination and other COVID best practice in the workplace policies so that we can protect communities in those two states.
Patrice Guzman. I said your name for you.
Yeah, thank you. Well, I am the college ambassador and program manager for the Black Girl Health Foundation. I'm responsible for organizing, managing, and executing all of the foundation's programs, events, and anything related to the work that our ambassadors are doing out in the communities.
Okay, great. Gail McCray.
Gail McCray from Morehouse School of Medicine. I'm on the faculty there. And with this project, I am focused on the training of health outreach workers. I have to catch myself sometimes, but health outreach workers. And, really COVID has challenged us to bring about all of our best creative energies to reaching the least of us. And so I think that we have engaged some really exciting partnerships, and we are doing all we can to ensure that people don't die unnecessarily or suffer unnecessarily from this thing called COVID.
Patrice Parsons.
Hi, Patricia Parsons. I am the program manager for HealthWorks, and I think it's very important for us that we identify partners within our community and engage them. Different organizations, public health districts, the HBCUs, and other colleges, as well as sororities and fraternities, beauty and barbershops, which was mentioned, radio stations, to make sure that we implement vaccination events.
Patricia, thank you very much. Dr. Chandra Wade.
My name is Dr. Chandra Wade. I am the consultant for Meharry Medical College in Nashville, Tennessee. I am responsible for the community engagement.
We would like to thank our special guests for joining us today. This HealthWorks podcast series is supported by the United States Department of Health and Human Services and the Health Resources and Services Administration. The contents are those of the speakers and do not necessarily represent the official views of, nor an endorsement by, HHS, HRSA, or the U.S. government. Don't forget to subscribe to receive notifications about future episodes, and be sure to share this information with your family, friends, and colleagues. Here's to bringing about a great change and improving health. Until next time, stay safe, be kind, and be compassionate. HealthWorks, providing trusted, culturally appropriate information and resources. We aim to strengthen vaccine confidence and prevent outbreaks of vaccine-preventable diseases where we live, worship, work, and play. Increasing access to vaccine and booster shots for diverse, medically underserved populations. Engaging communities, families, and businesses in the fight against COVID-19.